Hi, this is Paul Howell, Managing Editor for Singapore Business Review. And today I'm presenting the Technology Excellence Awards, celebrating all the best, the brightest, the most dynamic and the most innovative digital projects from across Singapore business over the last 12 months. Winning in the digital category for healthcare was Fullerton Health, and I'm joined now by Group CEO Kuen Loon. Kuen, thank you very much for being here as well.
Great to be here, Paul.
And also its General Counsel, Chong Jin. CJ?
Thank you. It's an honor to be here.
CJ, let me start with you. Can you tell us a bit about the Live Fuller AI-enabled COVID-19 symptom checker? What was this project and what was it all about?
So the Live Fuller application is essentially an AI-enabled function, which we rolled out at the beginning of a pandemic when there was a lot of lack of information at a time of great uncertainty. And it's something that we consciously rolled out across the region, and we are very happy that it was able to let patients have greater access to information and on the next steps that they could take.
Was there any one particular element that you and your team were most proud of?
So there were many elements. We put together a cross-functional team. There was obviously the IT team, our executive leaders, including Kuen, our two co-founders, and including me, the General Counsel. And that was because the healthcare space is very unique and is regulated. I think the most challenging element for us was to put this together in a quick time so that patients, depending on where the locations are and their unique needs, was able to access a tool that gave them both the security and the comfort of knowledge of taking the next steps, of being directed to resources where they could seek help, including mental help if possible. So I think putting everything together in a short amount of time was probably our biggest achievement. I'm extremely proud of that.
And I'd like to add on to what Chong Jin has said is that I think the ability of the team to be able to be agile and nimble, I think that's really a testimony of how we responded to COVID in the last 1 year. I mean, technology is really one key part of it, but the way that we responded to COVID, how we participated in the dormitories in Singapore to support it, and even today at the vaccination centers as well, right? So I think the ability for us to adjust to the situation, to be nimble, right, to adapt to the situation, I think that's really what we are really proud of the team.
Now, Fullerton Health is a private company, but most of the parts of this program have been widely available throughout the community. Can you tell us about some of the thinking and strategy behind making that so open?
The answer is actually quite straightforward for us. Our purpose statement is to provide affordable and accessible care to all in Asia Pacific. And we really see this opportunity to provide this application to everybody in the region that we are in the market with. So this is all about accessible and affordable in this critical situation. So it's a direct relationship to our purpose statement. And this application is really a piece of many other things that we are doing in this whole COVID situation in the last 1 year. This is a testimony also for the private-public partnership projects as well that we are in. And this project is subsequently also complement with all other projects that we are in, as I mentioned earlier, in the support in the dormitories for the migrant workers, in the support of the reopening of the economies, in the swab testings and all the pre-event testing, and more currently the vaccination centers that we are very involved in, which we have just done 500,000 vaccination just last week.
This technology obviously came about because of the COVID-19 situation. Are there further applications for that outside of such a pandemic environment?
For sure. I mean, I think the key part is that the ability to use questions to find out what is the symptoms, right? And the symptoms, I mean, besides the healthcare space, it could relate to many other areas, right? In this case was COVID related, but there are a lot of other areas in the mental wealth part, could be chronic disease, right? And just the breadth of diseases that we talk about, right? So that you can actually check the situation first before you do a consultation with doctors.
Technology and innovation are always changing the game in industry today. How does Fullerton Healthcare plan to stay relevant in such a fast-changing and ultimately very competitive landscape?
I think there are two parts to these questions, Paul. I think first is for us to really stay relevant to our clients and our patients, really to understand what they need. The advantage for us is that we have access to more than 10 million of patients, and that allows us to have a wealth of data to really know and understand our patient as well. Right? So that's part one. I think part two is really for us to stay relevant in the technology front as well. Right? As you know, technology is always ahead of healthcare. So we have a team that's really looking at what's in the market, what are our competitors doing, right? What are the technologies other industry are doing that we can bring into our industry as well? So this team analyzed the type of trend that is happening in the market and how it can be applied to serve our patients and our clients much better. So it's a combination of both that really allow us to stay relevant, right? And to really be competitive, right, in this very difficult and tough market.
And what will be your focus over the coming few years? Are there further initiatives that your stakeholders and patients can look forward to seeing from you?
For sure, this is just a starting point for us, right? We have a lot in store to really do a lot more on the health tech part, the health application part. We already have our own applications. In fact, we have a few applications, right? One of the things that we launched last year is really the telemedicine. And we have more than 500,000 teleconsults in the region that we have today, right? And together with symptoms checkers, together with many other pieces that we're putting it together, like the e-commerce, e-marketplace, right? One patient, one record. All this we put together as a one technology platform, and we'll be offering to our clients as well. So look out for more to come. This is just a starting point.
And finally, to both of you, what does winning in the SBR Technology Excellence Awards mean to you and your team?
I think first and foremost to the organization, right? I think we are really privileged to win this award. I think it's a testimony of the work that we have put in. Very proud of the team. I think the recognition needs to go to the team who make this happen. But most of all is really for our patients and our clients who is able to use these symptom checkers at a very critical time when the pandemic was really at its peak. And so it's really for everybody, and we are very glad to be able to contribute our part in the pandemic situation through this application. But as I said earlier, this is just the beginning, and we really hope to use this as an inspiration and aspiration for us to do more in this space, to use technology to enhance the delivery of care in the healthcare space.
So if I can just add on to that. So when this project first started, it was primarily intended as part of Project Big Heart, which is a philanthropic project that we do every year. And then it got expanded to the rest of Singapore and then very subsequently to the rest of Asia. I think the team should be very proud of the very good work they did in a very compressed period of time. And then all that also doing in a very challenging regulatory environment where the laws are still catching up with technology. So I'm extremely proud of the team.
Chong Jin and Kuen Loon, thank you both very much for joining me, and congratulations once again.
Thank you, Paul. It's an honor.
Thank you so much. I would like to thank the Singapore Business Review as well for this privilege. Thank you, Paul.